Hello, everyone. My name is Robert Johnson, student of Nightingale College. I am going to be redoing a video submission for drawing up insulin. I do have my ID on and my school uniform. So just going over, I'm going to be drawing up two different types of insulin into one syringe. For this skill, I have alcohol wipes. And also, I'm going to be using a insulin safety syringe that is actually properly gauged in units for drawing up insulin. Okay, so first things first, I need to verify the healthcare provider's orders. I need to verify the 6 rights of medication administration, which is going to be the right patient, the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. Those are the 6 rights of medication administration. I will be doing it 3 times of that verification throughout this whole skill. I would also now check the medication orders and the electronic health records, right? And then from there, I will verify the dose that I will be giving in units of. So it's going to be, or verify the dose I'll be giving of the insulin. So first it's going to be the regular insulin. It's going to be 4 units of the regular insulin. This is a short-acting insulin. So then also 4 units is going to be combined with the NPH. Now the NPH is an intermediate insulin. It lasts a lot longer in the patient's blood or in the patient's body. That both of those will be combined inside of this one syringe for a total of 12 units of insulin. So after I confirm that, I will make sure now. I will go ahead and go to the patient's room and introduce myself. So I'll go to knock on the door. Hello, Mr. Jones. My name is Robert, student from Nightingale College. The reason why I'm here, as you know, we just finished checking your blood glucose level about 10 minutes ago, and there's an order for you to have insulin because your blood glucose level is actually at 168. So your doctor does have a sliding scale for us to follow and to give you insulin for that. Okay? All right, so give me a moment. Let me go ahead and wash my hands and provide some privacy. So I'm going to pull the privacy curtain. And now I'm going to wash my hands at the sink, although I do have hand hygiene here at the desk, right? So, washing my hands, good. So now that I wash my hands, I'm free to touch the patient safely. Mr. Jones, can I please see your ID band so I can verify have you verbalize your full name and your birthday? So right here we have, the patient's going to verbalize. His name is Raymond Jones. Birthday is March 10th, 1955. Patient did verbalize that. And now I will go over the medication with Mr. Jones. So first, Mr. Jones, do you have any allergies to seasonal allergies, medication, or any allergies to any type of foods? No. Mr. Jones confirmed he has none of those allergies. I would explain to Mr. Jones that that because his meals are coming within the next 20 minutes, once again, this is why, and his blood sugar level, as we just checked it, is at 168. This is why we need to give the insulin now. So because, so the meals will be here in 20 minutes, Mr. Jones, we'll go ahead and get your insulin so that we can have you properly prepped for that meal, right? So I already checked the patient's ID. Mr. Jones confirmed that he has no allergies or anything like that. So because I checked this ID and confirmed that, now I'm going to go ahead and check this medication against the MAR, right? And confirm that everything looks right with the 6 rights. Medication looks good on the 6 rights for both medication, right? So from there, I need to also check to make sure that this medication is not expired, right? So we check both bottles, making sure they're not expired. Everything looks good there. And because the medication was not refrigerated it wasn't fresh out of the refrigerator, we don't have to wait for it to be at room temperature, right? Because with the med cart, put that out. Now, I would also explain to Mr. Jones the medication. So the first one, I would explain to Mr. Jones, the first medication is a regular insulin. I would tell Mr. Jones that this is a short-acting insulin. It will last in your, it's set up to last in your system for 30 to 60 minutes for meals. The mechanism of this medication, I would inform Mr. Jones that it is to draw glucose from his blood and to be used as draw glucose from his blood into the cells and to be used as energy. The purpose is to lower the glucose levels. And like I said, we give it 30 minutes to 60 minutes before your meals. The side effects of this medication includes hunger, anxiety, shakiness. And then also I'll go over the adverse reactions with Mr. Jones for this medication, which includes, and I'll also make sure I explain to Mr. Jones that we don't want any of the adverse reactions. So Mr. Jones, some of the adverse reactions we also got to be mindful of is going to be tachycardia. Your lips could go numb, or even a seizure. If you have any type of side effects or adverse reactions, please let us know so that we can be able to keep the doctor informed and go from there, right? I would also let Mr. Jones know that, yes, I would also make sure that Mr. Jones have a chance to ask questions about this medication. Any type of questions, I'll make sure that I provide enough information that I'm thorough. I'll go over it. Mr. Jones, do you have any questions about the medication? Not at all? Okay. So Mr. Jones has no questions about that. So the next one is going to be 8 units of the next insulin. It's going to be 8 units of the NPH. And this is the intermediate insulin. This one will be combined with the regular insulin. This one actually is going to, I would explain to Mr. Jones that this insulin is longer acting, meaning that it lasts in the body a lot longer. I would explain to Mr. Jones that this insulin will be in the body actually for maybe even half the day. It has the same actions as far as mechanisms working, which is to lower Mr. Jones' glucose level, as drawing the glucose from the blood into the cells for it to be used as energy for later on. I would also explain to Mr. Jones that this insulin also still has its own side effects, a little bit different from the other one. Although this one will be in your body a lot longer, you still have to be mindful of the side effects and the adverse reactions. So I will go over those adverse reactions with Mr. Jones. The side effects that I would like Mr. Jones to be aware of, that it could include weight gain, sweating, and water retention. This is for the NPH. I would also explain to Mr. Jones that this medication will have adverse reactions such as confusion, generalized weakness, or even headaches. And once again, I'll give Mr. Jones a chance to ask about that medication. Okay, so during this skill, I'm going to also have another nurse here with me to verify, fellow nurse, to verify the dosage compared with the MAR and making sure that I'm getting the right dosage. She's just another set of eyes to make sure everything looks good. Then from there, I'll go ahead and ask Mr. Jones, does he have any questions at all about the medication? No? Okay, I'll go ahead and get started. So I'll do hand hygiene again. And then from there, I am going to put on my gloves. Right, it's already confirmed that the medication is not expired. So that's good. Let's see here. So I have my fellow nurse here. Nurse Agnes, she's right here next to me. So since Nurse Agnes is here, I am going to go ahead and, first things first, I am going to not shake, but I'm going to roll the insulin in my hands, into my hands. Just going to roll those just to make sure that they're properly mixed. Okay, I'm going to roll this insulin, make sure that that's properly mixed. I'm not going to shake it, just gently roll it. Right? Okay, good. So now that I rolled those, I'm going to go ahead and open up my syringe. And first things first, let me wipe off the top. Now that I'm done rolling, now I want to wipe off the top of the syringe. I'm sorry, I want to wipe off the top of the insulin bottles with this alcohol wipe. I've got 2 alcohol wipes I'm going to use, one for each bottle. So let's do the NPH. Let's get rid of that one, throw that in the trash. And then I have another alcohol wipe. I'm going to wipe off the top of the regular, right? So we're going to let that air dry for both of those. Okay, now for prepping, I have the syringe here. I am going to draw up, with the cap still on, I am going to draw up 8 units of air. I'm just going to pull up 8 units of air. Here we go, here. 8 units of air. 1, 2, 3. Good. 8 units. Okay, I have Agnes here to verify that 8 units right there. I'm going to bring this closer to you guys to see it. For you guys to see the 8 units. I'm sorry. There's the 5, and you want to count the 3 there, right? 8 units of air. All right, so with this 8 units, I am going to take the cap off now. And I am going to, the NPH, I'm going to gently put this 8 units of air inside, or put the syringe into the medication bottle. Good. Syringe in the medication bottle. I'm going to inject the 8 units of air. Good. Now, I want to make sure I do not touch the solution. Do not want to touch the medication. Pour that out. And then I'm going to draw up 4 units of air. All right. Let's go with 4 units of air. Let me find that 5 and just go right up under the 4 units. Okay. I have Agnes here to verify that is 4 units of air. Good. Now I'm going to bring that closer to you. If you can see that, 4 units of air. There's a 5 there. All right, 4 units of air. Okay, I think you can see that. All right. So then from there, I'm going to gently put that into the medication bottle, and I'm going to inject the 4 units of air into the regular. And the purpose of that is the amount that we put into the bottle is the amount that we're pulling out. Now, at this point, I'm going to invert the bottle, and I'm going to pull out 4 units. Okay, 4 units of air. 4 units of insulin, the regular. All right, 4 units of insulin. Okay, right above the 5. So on this one, we want to always make sure we don't have air bubbles. So we want to remove the syringe from the bottle because this is insulin, and we're going to be mixing it with another one. So we want to remove the syringe and we want to tap it. If there's any air bubbles, then we want to just gently press on the plunger to get the air bubbles out, or to get the air out. And then from there, we'll go ahead and have Agnes confirm. She confirmed there's nothing there. And then have you guys take a look at it. And, right, have you guys take a look at that one there. And, right, there's 4 units. And then from there, we want to go to the NPH. We want to gently put this in here inside of the syringe. Gently put it in. Now we want to convert or invert the bottle. And now we want to pull out 8 units, making it a total of 12 units. All right, 12 units. Right, good. And making sure we don't press on the plunger at all. Just making sure, where's that? Good, there's a 10 and 12. Good, so we got that. Now I'm going to show you guys that one. There's 12 units, right? Now I'm going to have Nurse Agnes confirm. She's also, when I say confirm, she's looking at the amount of medication there, and she's checking the MAR. And because I got to prep the patient for to receive this injection, I'm going to do a 1-hand scoop for safety reasons, right? And because I'm at the patient's bedside, I don't have to label this because I'm preparing everything right in front of the patient. But if I was away from the patient, I would label it first with what's on the medication or what's in the syringe. Then I'll take it to the patient's room. But I don't have to do that. Thank you very much. Oh, I'm sorry. I would definitely, when I'm done with this, I'll go and document the skill after I'm done. Wash my hands. I'll wash my hands, hand hygiene, check on the patient, and then I'll go and document the skill. Thank you.